My name is Padma Genesh and I am the Learning Specialist at the Alzheimer Society of Calgary. Let's now move on to behavior segment. Dementia can be associated with several behavior changes. In the initial stages, the majority of individuals do have an understanding of the changes that's happening to them. The memory loss, the confusion, and the number of incidents they're making mistakes. All of those lead to anxiety, irritability, frustration, and even symptoms of depression. As the disease progresses, several other behavior changes begin to surface, and these include anger, agitation, aggression, general emotional disturbances, getting easily frustrated, inappropriate behavior, which could be verbal or physical or verbal outburst, restlessness, pacing, hallucinations, where a person sees things that do not really exist, or having delusions, where a person could have strong belief about something which is false. Other behaviors include having sleep disturbances and getting extremely agitated towards sunset, which is commonly referred to as sundowning symptoms. What impacts a family much more than the memory loss associated with dementia is actually the behavior changes and the personality changes. Now, we believe that every behavior actually has a meaning. It could be the way that the person is trying to communicate that something is just not right. And every action that is performed by a person with dementia does have some meaning. So when we see a behavior change, the best thing to do is actually to take a step back and try to find out where this behavior is coming from or what exactly is causing this behavior. Some triggers for behavior changes include health or medical causes, such as discomfort from medications or discomfort from medication interactions, pain anywhere in the body. Especially pain, what is seen is that individuals with dementia have difficulty expressing pain and pain goes untreated. So, pain anywhere in the body can be a trigger for behavior change. Delirium that is arising from infections can be another medical cause that leads to behavior changes. Impaired vision and impaired hearing can also trigger behavior changes. Behavior changes could also be due to an unmet need, which could be a physical need such as hunger, thirst, or it could be that the person is feeling too cold or too hot, or even the lack of meaningful engagement as being too bored and having nothing meaningful to do. Even missing a family member and feeling lonely can also lead to behavior changes. Changes in the environment can be a trigger for behavior changes, and these include lighting. Is the light too bright or is it too dark and the person is seeing shadows that is scaring them? The temperature around them, is it too hot or too cold? That could trigger a behavior change. Any unfamiliar faces, like new staff members in a care facility, could be a trigger for behavior changes. Having unfamiliar people or crowd could be a trigger for behavior change. And new challenges in the environment, such as moving the furniture around or a new set of stairs, could be a trigger for a behavior change. Last but not the least, the way we interact with the individual with dementia can also trigger behavior changes. Our approach and our attitude. How are we communicating with the individual with dementia? Are we correcting too much? Are we arguing? Are we bringing them back to our reality rather than playing along with their reality? Are we asking them or forcing them to do things that they really don't want to do? All these interactions can be important triggers for behavior changes. So when you encounter a behavior change in a loved one with dementia, it's good to take a step back and think about what is causing this behavior change. It all begins with actually observing the behavior. What is the person saying? What is the person doing? What is the emotion that is expressed? Then you make a decision as to whether you need to interfere or not. There are two conditions where a behavior has to be addressed. Is the behavior harmful? Is somebody going to get hurt? Or is the behavior escalating with time? These are the two conditions where it's wiser to actually interfere and redirect the person. One way to proceed is actually looking at when is the behavior happening? What are the activities that are leading up to the behavior? What was the conversation going on? Who were the people around? What time of the day did it happen? And what activity was going on at that time? This might help you find a pattern to the behavior, and just by changing the situations around, you might be able to prevent that behavior altogether. If that is not possible, the next step would be to look for the possible triggers for the behavior change. Could it be due to a health condition that is not recognized? Then maybe the person needs to be seen by a doctor or a nurse. Could it be due to an unmet need? Try to look for that and try to fulfill that need. Or perhaps the behavior is arising because of changes in the environment, and perhaps we can do something to make the environment a little more friendly for the person. Or maybe it is a way we are interacting with the person, and that is something we can modify and make it more compatible for the person. Here are some general tips that you can follow when you are encountering a behavior change. First of all, reassure and comfort the person. Talk to the person in a calm and reassuring way. Even if you are panicking on the inside, remain in control. It's a good idea to monitor personal comfort and meet any unmet need. Avoid being confrontational and try to avoid arguing, correcting the person, or bringing the person to our own reality. It works best if you can play along and enter their world. Acknowledge requests and try to respond to them. Try to look for reasons behind the behavior and explore the various solutions. Create a calm environment or move the person to a quiet space. It could be that the stimulation in the environment might be causing that behavior change. If you cannot think of any possible triggers that has caused the behavior, it's a very good idea to redirect the person to a favorite topic or a favorite activity. Maybe play their favorite music or give them a drink or a cup of tea or something to distract them. Allow adequate rest between stimulating events. Maybe there's been too many things going on and the person needs a break. It's a good idea to provide a security object. If you see that the behavior is escalating and you could be hurt, take a step back and make sure that you are safe. You can even step out temporarily and have a timeout and come back, and you might see that the behavior has changed already. It's very important to understand that whatever they say and whatever they do is not deliberate or intentional. It is just the disease that is causing it. Therefore, do not take their words or their actions personally, and share whatever you have learned with the care team as well. At the Alzheimer Society of Calgary, we believe in person-centered approach, and we believe that what works best is more hugs and less drugs. So here are some non-medical approaches to behavior changes. Music therapy is supposed to be very beneficial for managing behavior changes, especially if you are playing music that is very familiar. And if that happens to be the person's favorite music too, you will see the remarkable change that happens when you play the person's familiar favorite music. Music can actually bring down anxiety, reduce agitation. It can evoke positive emotions and connect with positive memories. And you will see that the behavior changes are actually decreasing in frequency. Another helpful approach is art therapy. Both creating art as well as appreciating art can be very helpful in managing behaviors. A person can have an increased self-esteem looking at the art that they have created, and this is also a good way to reduce anxiety and agitation and calm the individual. Another helpful therapy is having pets around, pet therapy. And this works especially well for people who are well advanced into the disease and have communication challenges. The unconditional love and companionship provided by pets can be extremely relaxing and comforting for the individual with dementia and can decrease behaviors. So with this, we come to the end of the segment on behavior changes. If you need more information, please visit our website alzheimercalgary.ca. Thank you for your time.